I just want to tell you that doctor said that the fact that mosquitoes don't bite me is a very good thing, and we need to find a way to promote it so that less people are mosquito bitten.
Oh,
thanks, Doc.
Wow. Doc, you need a lawyer.
She's going to deny me. Ministry of Health and Wellness. Serious things now, folks. Very seriously. Recently issued an MPox alert that's urging us to take the necessary precautions to safeguard ourselves from this disease. Joining us now, Chief Medical Officer, Dr. Jacquiline Bisasor-McKenzie, to tell us more about this alert, more about MPox and how we can keep ourselves safe and our nation healthy. Good morning, Doc. Good to have you.
Good morning, everyone.
I was so hoping we would not hear about this again, but here we go again.
Here we go again.
Warning triggered from, where was it initially triggered from? Was it
in Africa?
Where was it?
WHO gave the alert, yes, on August the 14th to say that it was now considered a public health emergency of international concern. But the spread has been continuing in Africa.
I did not know.
Yes, over the years, over 2023 and into 2024. Remember that we first had the alert in 2022, and that was downgraded, you would say, in May 2023, as we didn't have, it wasn't considered to be of so much concern. But certainly it remains a public health concern, certainly in the countries that are affected.
But when the WHO says no, it's at the case where it's of international concern. What does that mean? As a measure now, we're talking different level.
Yes. This is the highest alert that the WHO issues. It is meant to really stimulate action in terms of getting funding to provide the help to the countries that need it, to provide the medications that are needed, and really to stimulate research. You know, I mean, when it was downgraded, probably people took it off their plate.
Yes.
But when it's upgraded again, you know, that more attention is needed.
Let's first of all now tell the public, what is MPox?
Okay, so MPox is a viral disease. It was first discovered in the 1950s and from monkeys initially, but no longer. So it's no longer called monkeypox. It's called MPox now because we don't want to be associated with monkeys alone. You can get spread from other animals and, of course, human-to-human transmission. It is on the same family as smallpox. It is usually a mild disease for the most part, and persons will recover. But, of course, there are some persons who will develop severe illness and can be fatal in some cases.
And what would predispose someone to? Is that the same underlying conditions, or what would predispose you to?
Persons who have decreased immunity, immunocompromised persons. In the last outbreak, we saw that a large number of persons that were HIV infected were infected, and we had some bad outcomes across the world. So there are two types of monkeypox, MPox, sorry. There are two types, clade 1 and clade 2. In the last outbreak in 2022, it was clade 2, which is thought generally to be the milder form. Clade 1 is thought to be have a higher mortality rate.
Wow.
And throughout 2022, we only had clade 2 that was spreading. However, clade 1 has existed and is endemic in some countries in Africa. In particular, clade 1A is endemic in Democratic Republic of Congo, where we're having the spread now. And so what you're finding is that you have different types of manifestation emerging, because you now have clade 2 from before that is spreading. You have clade 1A that has been endemic in DRC, and now you have the emergence in September last year of clade 1B, which is new. So we are now discovering, you know, what exactly this clade 1B is.
It mutates. It's like strains.
These
like
are strains.
COVID is doing.
Yes, these are strains.
Some people might be listening now, Doc, and say, "Oh well, that's in Africa. I mean, why should we as Jamaicans be on the alert? Why should we?"
Well, I hope that after COVID persons would know better now, because that's the same thing that with when we had outbreak of COVID, first Wuhan virus in China. So with international spread of international travel, of course, everything is just always away, you know. So persons who are in Africa can be here, persons can be incubating illnesses, and then when they come, there's a manifestation of the illnesses here. So since there has been the declaration, and even before the declaration, there was spread not just in DRC, but the countries around DRC, and I think it's between 13 to 16 countries in Africa that we're seeing cases. So they're spread on that continent, and then of course with travel you are going to have spread to other. And so we have had cases in Sweden and in Pakistan since then, and I'm sure that you will find more countries reporting, you know, very shortly. So with travel, nothing now is restricted, and Jamaicans love to travel. Jamaicans are everywhere, and of course, because we're a prime tourist destination, not just tourist destination, but business as well, there's a lot of international travel and trade that occurs between Jamaica and other countries. So we are at risk just like any other country for the introduction of this virus, this new type.
How many cases have we ever reported here? Is it just one that we...
Well, so generally speaking, you know, in the region of the Americas, we had over 60,000 cases. And the majority of those were in North America and South America. But in the Caribbean sub-region, we had 107 cases. And in Jamaica, we had 21 cases.
21.
Yes.
It's the pox family, smallpox, chickenpox.
Right.
It's actually not, and I think I made an error in an interview before. It's in the same family as smallpox, but not in the same family as chickenpox. But it looks similar.
Yeah, because I was going to ask you if you've already had it, are you still able to catch it again, or does that make you immune to it?
Okay, so at one time it was thought that there was long-term immunity. However, it is evolving. You know, the picture is evolving, and then clade 1B is new. So you don't know. And certainly in the last outbreak, we would have seen repeated recurrences, repeated infections in persons. So yes, there is the possibility that you can become reinfected.
Interesting. Okay, so how do we not get infected in the first place before we even reach reinfection? What do we do to protect ourselves? I saw something there about vaccination. There's a vaccination for MPox?
Yes, there is a vaccine for MPox, because remember, smallpox was eradicated with the introduction of the vaccine, and so the wherewithal as to how to produce vaccines for this family would have been there. So there have been modifications of the smallpox vaccine, and so there is vaccine available for monkeypox. But before we get to vaccine, we have to talk about prevention.
Yes.
Because it is an infectious disease that is transmissible by person-to-person contact. And close physical contact is usually required for there to be transmission. Persons that are ill with monkeypox will start developing flu-like symptoms, fever, headaches, muscle pains, joint pains, swollen lymph nodes. And after about 4 days, they will start having the lesions. Once they have the lesions, then the material from the lesions can be transmitted. But also in terms of the droplets in saliva and respiratory droplets, then you can, in close conversation, it's not airborne, but certainly in close conversation, long, prolonged conversation, persons can pass it. Things like kissing, you can pass the body fluids, skin-to-skin contact, sexual contact. Of course, we know that in 2022, it was clade 2 was mostly associated with men who had sex with men, and not just men who have sex with men, but general sexual contact. It was thought to be sexually transmitted, and that is what we're seeing with clade 1B. But clade 1A, we're seeing a lot of contact among children. And so in the DRC, clade 1A is chiefly among children. And this is because of the close skin-to-skin contact. Because in that country, you have these refugee camps where you have a lot of children together. So everybody is at risk.
Yes.
Because once you have close contact, then you can transmit it to persons. So the precautions are that really and truly persons should maintain their infection prevention and control measures that we have preached over and over from COVID, hand washing, hand sanitizing, physical distancing, are things that you must adhere to. But in terms of close skin-to-skin contact, you should try to avoid that. And safe sexual practices, sticking to one sexual partner, using condoms. These are things that persons do not share, things, because not just person to person, but also you can have infected material like bedding, clothing, towels, that the virus will remain in for a short while, but you can transmit using that as well. And then from mother to the fetus, you can have transfer from mother to baby while the baby is in uterus. So everybody is at risk, and everybody needs to watch out to make sure that they're taking these precautions to prevent transmission. Early detection is very, very important. With monkeypox, once you see the lesions, people tend to be more aware, and the lesions can be painful. And so people tend to be aware. But once you think you have, first of all, if you've had contact with somebody, if you've traveled to countries and you've had contact with persons who could have had monkeypox, or you may not even know that you have had contact with somebody, but if you feel ill, start developing fever, headache, flu-like symptoms, then you should see your private practitioner, your public health person, whether it is in your GP's office or in your health center. Call the health department for advice, and we will arrange to have the necessary consultation and checks done. So early detection, people have to be very self-aware, because these are sometimes the skin lesions are not openly visible, because you may not see them on some person. Some person may just be in the genital area or somewhere else that is covered. So there has to be self-awareness and the understanding that from public health we must know, because especially with a new virus being present, then we want to know if we have it, because then we would need to know what are the risks to the population, because a different set of messaging, is it that we're still having it mostly through sexual contact, or is it that it's the clade 1A that, we tend to get children affected. So it's very important for there to be self-awareness and for people to report when these things are happening. And if you see your family members or persons that who are sick, having had traveled or having had any lesions, then you should report.
Thank you, Doc.
I'm tired.
It's always good to see
Jesus,
you.
I'm tired.
And we always have to thank you for the work that you do for us.
Sure.
And we just hope people are listening and people will, take the necessary precautions and do the reporting. Thank you very much for being here. Chief Medical Officer, Dr. Jacquiline Bisasor-McKenzie.
After the break, we have some tips for parents who are preparing for back to school. Soon come.
Yeah.